to a presentation, but it's really lovely to be here. And I want to start with Amartya Sen's capability approach, in a sense also in honor of Stefano Zamani and his leadership here. As many of you will remember, when Amartya Sen gave his first lecture on the capability approach in 1979, he compared the capabilities of a person living with a disability and a person that did not experience that disability. And he observed that if we look at resources, that they might have equal resources, but the functionings, the capabilities they enjoy would be different. And he urged social scientists to try to focus on the outcomes, the capabilities that people value and have reason to value. And these will have different needs for people with differing abilities and differing conditions. And so that is one framework for thinking about our topic, which is poverty and disability. But it's not the only one. As we heard, Ubuntu, liberation theology, integral human ecology, other frameworks would also have a way of articulating the importance of the objective of human flourishing in all its dimensions, and also recognizing the specific interest in how that flourishing is experienced among people with a disability. And as we heard Matilda also say, when it comes to people living with disabilities, one political hook and one thing that this academy could do is work on the environmental situation, the environmental factors. So this presentation is very much on environmental factors, actually on multidimensional poverty among people living with disabilities. And if you simply look at the literature across 15,000 records and 150 studies, you find that in nearly every study, empirically, poverty, whether it is monetary or multidimensional, is higher among people living with disabilities. And it is particularly higher when people are not simply monetary poor, but also deprived in other things at the same time, be that housing, education, nutrition, work, and health outcomes. And this is the case also not just overall, but if you look for women, for men, for different types of disability, then these disparities persist. But at the moment, it's very difficult to get global data, particularly in developing countries, on the association between poverty and disability. So this paper, which is really led by Dr. Monica Pinilla, is disaggregating the global multidimensional poverty index by the disability status. So the global MPI has been released by the United Nations Development Programme with ourselves since 2010 every year, and it measures acute multidimensional poverty as a complement to the World Bank's $2.15 a day, covering roughly the same number and population of developing countries. Going beyond $2.15 a day, it's disaggregated by over 1,200 subnational regions, by age cohorts, by rural urban areas, and female and male headship of the house. And there are trends over time for about 5.5 billion people. But in these data sources to date, comparable data on disability status has not been available for enough countries for us to release a global headline. So this paper now explores data for 51 countries. And for adults, we have the Washington Group questions on disability, though they're not exactly comparable. And for children, we have those plus some other functionings. So this paper offers, in a sense, the first comparable analysis at this scale of multidimensional poverty and disability. And just to go back with what we are meaning by poverty, we look at the household level because households share and care for each other. And you are deprived in nutrition if anybody in your household is undernourished, in child mortality if sadly a child has died in the last 5 years, in years of schooling if no household member has completed 6 years of schooling, in school attendance if a child is not attending school up to the age of which they would complete class 8, if you don't have clean cooking fuel, adequate sanitation, safe drinking water, electricity, a good quality of housing materials, and more than one of a small set of assets like radio, television, telephone, refrigerator, animal cart, computer, bicycle, or motorcycle. then you are deprived in each of these 10 indicators. And so each person, each household receives a profile showing in which of the indicators they are deprived. And if they're deprived in a critical mass, which here means 1/3, then they are identified as multidimensionally poor. And in the most recent data, we cover 6.1 billion people in 110 developing countries, and 18% are poor, being deprived in 1/3 or more. And half of those people who are poor are children. And this is a very acute definition of poverty, so most prominent in sub-Saharan Africa and South Asia, where 83% of the poor people wake up in the morning. One of the values of the global MPI and the value it may have for this group as we reflect on policy and disability is that the measure is built on the exact profile of deprivations of all poor people. It actually takes all of the deprivations of poor people, weights them, and adds them up. And so when you look across the regions of the world on the left, the top and largest bar is sub-Saharan Africa. When you pull that region apart by countries, the middle panel shows the countries of sub-Saharan Africa. And in Niger, over 90% of people are poor, whereas in the Seychelles, it's less than 1%. So there's a big distribution across the countries of sub-Saharan Africa. But if you take one roughly in the middle, like Senegal, again, you see a very large range between the subnational regions of Senegal. But if you were charged as the governor of a region of Senegal, then you would want to know what to do. And the striped colored bars show the number of people who are deprived in each indicator, weighted. And so this is used in many countries then to shape policies to redress poverty. So as I mentioned, this is disaggregated in this slide by state and by other groups, but not yet by disability status. In December, in this pre-workshop, we showed results for 9 countries with comparable Washington Group statistics data. And now Monica has done this for 51 countries. All of these countries have global multidimensional poverty data. And in addition, they either have the Washington Group questions or questions on child functioning. And 40 countries used multiple indicator cluster surveys from UNICEF, and 12 used demographic and health surveys. We divide this presentation into looking at households in which some adult is living with a disability. And we have those data for 23 countries. And for 39 countries, we have data on whether a child in a household is living with disabilities. For 11 countries, we cover both. But at this moment in the research process, we're keeping them separate to keep track. And you can see them mapped there on the globe. So they are from all world regions. I mentioned in the global index, we cover 110 countries and 6.1 billion people. The 51 countries with data on whether somebody is experiencing a disability are home to 1.6 billion people. And if we look a little bit further, for adults, we have data on disability for 769 million people. And of them, 124 million people share their household with at least one person who is experiencing a disability. And over 1/3 of households who live with a person with a disability are multidimensionally poor. That is, they're deprived in 1/3 or more. Remember, at a global level, it was 18%. The countries that we focused on are poorer than the global average, but it's still a much higher number. Coming to children, we have data for 929 million people who share their household with a child who's experiencing a disability. A child is somebody under the age of 18. And 205 million of those 929 have a child with a disability in their household. And 88 million of them, 43%, are poor. So again, quite a high figure. So before we go into those really sobering findings in greater depth, then, and I should say that if you look at all of the 769 million people and those who do not share their household with a disability, 29% of them are poor, but 35% if you have a disability. But among children, for the households that don't have a child with a disability, only 18% of them are poor. Whereas if they have a child with a disability, it's 43%. So these disparities, which to our knowledge are the first time to come out, are really quite sobering. A word on definitions before I hand over to Monica to do the hard part. The Washington Group of Questions identifies whether a person has either a severe difficulty or cannot do one of these functions: seeing, hearing, walking or climbing steps, remembering or concentrating, washing and dressing, or understanding and being understood. So that's how we identify adults. And for children, in addition to those domains, the child module also looks at things like anxiety, depression, development, and playing with other children. And they're compared to their age peer groups, and there are different categories for different ages. So when we talk of a child living with a disability, that's the domains we're looking at. And one last health warning. This is a work in progress and the data are imperfect. So for some of the 23 countries, we only have data on women aged 15 to 49. So no males and no people aged 50 or over are captured in our data on disability, making this an underestimate. In some countries, we also add men aged 15 to 59. A few surveys have older adults or all of the household. And similarly, for children, the problem is that in some countries, after the demographic transition, the number of children and the number with disabilities are very small. So statistically, it's a challenging exercise. We've had to drop, I think, 6 countries where that was not possible. And also, we want to know within Nigeria, for example, things at the state level. We want to know gender specifications, which disabilities are the biggest, but statistical needs and sample size are constraining this. I turn now over to my colleague for drilling down into those findings.
Okay. Thank you very much, Sabina. So now, yeah, it's just like we can present the slide. Okay, so now we're going to talk a little bit about the results and the disaggregated results. So I'm going to present difference between adults with households with adults with disability and children with households with children with disabilities. So this graph presents the incidence of poverty for households with and without disabilities. For those who are in the bar that is blue, is the bar that says or represents households with adults with some disability. And those who are like red, dark red, is the households with no disability. So what we're seeing here is that in most of the countries, we see that there are differences between those households who have at least one adult with disability compared with the levels of poverty of households who don't have adults with disability. This is more clear in countries like Gambia, where you see like the difference. Okay. I don't think that it's obvious, but you will see like the difference between the blue and the red bar, and those differences are significant. What we found in the previous paper that Sabina, that is available online, and that it was the first representation of the levels of disability of households with and without members with levels of poverty of households with and without members with disability. What we found is that in houses or in countries with higher levels of poverty, the differences were not significant. In here, what we are seeing with new data is that the differences start becoming significant, and this means that the households with people with disability are left behind. So there are like a lot of these countries have reduced significantly poverty over time from the first time for 10 years ago to now. But what we see is that households with disability are now poorer than households without disabilities, and this reflects they are left behind, and we are not implementing all the method or the policies that we need to implement. This is for children with disabilities. So in here we have the bars that represent households with at least one child with disability, and the dots that are not really visible, my apologies for that, for households without children with disabilities. Again, what we see is like in the household, in the countries where the levels of poverty are higher than 10–15%, we can see clearly that households with children with disability are poorer than households without children with disability. And this is over the whole distribution. It is not possible to see it, but in the countries with the lowest level of multidimensional poverty, there are some differences that are significant. What means that households with children with disability are poorer than households without children with disability. So one of the questions is why? Why is creating these levels of poverty? And one finding that we have in this disaggregation is that the deprivations in nutrition are one of the most relevant, or the ones who are contributing the most to households with living in poverty that have children with disability. For example, in here we see a graph with different countries with the purple lines representing the deprivation of households who are deprived in nutrition and also multidimensionally poor in different countries of the region of the world, and in blue it will be for households without children with disabilities. If you see in the, we have highlighted in there that in Gambia, 38% of households live with at least one child with disability, and they are poor and deprived, in nutrition, and this is compared with 13.8% of the households who are deprived and poor in this indicator, but they don't have children with disability. The same happens in Bangladesh, in Sierra Leone, and we can see in the whole distribution that this difference is important in here. This is not something that is new. Like, there are research that shows that children with disability are more likely to be undernourished, to be stunted, they are left behind. What is important in here is that in the context of multidimensional poverty, what we are seeing is like these households are becoming poor, or are poorer because the children with disability are probably undernourished, and they need, and it's like a policy that we need to establish that is like not left behind children with disabilities. We really need to go and find them and give them the nutrition stage that they need. This is another shocking example. In the case of Haiti, that is like, this is using data only for adults. What we see is that Haiti is one of the poorest countries in Latin America, is the poorest countries in Latin America, and it faces levels of deprivation in most of the indicators higher to 30%. When we compare both of the graphs in the left side, that is persons with households with persons with disability, and in the right side, that is households without persons with disability, what we see is that in most of the indicators, except child mortality, we have the households with at least one adult member with disabilities are higher or present higher deprivations in all the indicators. And this is quite shocking because we say that persons with disability, like if you reduce multidimensional poverty, persons with disability and their households, again, they're left behind, and we really need to focus on them. And if we move to analyze similar things, but in the case of households with children with disabilities, we see similar patterns. What we're seeing here is 3 countries, Ghana, Gambia, and Guinea-Bissau. My apologies for the pronunciation. And we see the graphs for households without children with disabilities and households with children with disabilities, and we are comparing both of them by the deprivation. So each of the bars represent the deprivation in one of the indicators of how this will represent the percentage of people who are deprived and multidimensionally poor in each of the indicators. And if you see in the graphs that represent people living in households with children with disability, in all of them, the deprivations are higher. And this means that even in Ghana, where the deprivations are like the highest, like is 32%, persons with disability are facing those deprivations. And if we go to Gambia, that the deprivations are higher, in some cases that 60%, persons with disability are present in this. And we can see this case in the whole distribution of the countries. So persons with disabilities and their families are more likely to be poor and deprived in most of the indicators. And this is an important finding because, as Sabina mentioned, this is the first time that we do this type of disaggregation at the global level. So when we think about the deprivations for households with children with disabilities, what we know is that of those 22 countries of the 40 that have significantly different levels of multidimensional poverty between households with and without children with disability, the deprivation of those households with children with disability is always higher. And nutrition is the most shocking deprivation. And when we move as well to think about like a specific case, which shows Bangladesh because in here we can see the difference. So you see in the blue bars, households with children, with people with disability, children with disability, and the red bars, households without children with disabilities, and you see that the differences are sometimes shocking. So you see in the case of nutrition, again, households with children with disability have almost 15, 16 percentage point higher deprivations than households without children with disabilities. And in other indicators like housing or sanitation, you also see this difference, and these differences are significant. Ideally will be not only to have aggregated at the national level, but to go in the regional or sub-regional level in order to see how these differences are. What we are expecting is that households with girls with disability will be in a worse condition than households with boys with disabilities, but unfortunately the data doesn't allow us to do this type of disaggregation. And this is another example that we have in here, and we put it in here because it's the case of Zimbabwe, and we see the contributions of each of the indicators to the MPI. And we have the contribution of households with children with disabilities in the left side, and the contribution of households with children without disabilities in the right side. And we see again this shocking higher contribution of the nutrition indicator that is showing us like a really important problem in there. Because if we think about the consequence of having children with disabilities undernourished and how they get there, and like the consequence, like the causes, but also the consequences, we see that we really need to take action in most of the countries, including in the analysis. So just to conclude and be over and don't go beyond the time. So if people with disability share their households with a person with disability, we know that 35% of them are poor, compared with 29% of those who live in households without persons with disabilities. In the case of children, it's 24%, those who are poor versus 18%. And one thing that we need to keep in mind is that if we see of the total number of households with children with disabilities, 43% of them are multidimensionally poor. That is a really important and shocking number. And nutrition is the deprivation that is contributing the most. And we need to think that in those households, especially with children with disabilities, they are deprived in all the indicators. So they are not only deprived in nutrition, that's the indicator that is contributing the most, but they are deprived in access to water, sanitation, housing, years of schooling, school attendance. And another thing that is important here to consider is that what we are saying in here is what the data allow. I know that we would like to see more, but unfortunately the data doesn't allow us to do more, but this is the first time that we have this possibility. So it has been a call for new data for years and years, and those who work in data collection for persons with disability know how difficult it has been to collect data on disability and have like comparative measures. I know that some comparative measures that we call comparative are not, they have the problems when you apply in the different data sets, but this shows important results and shows that persons with disability, children with disability are left behind, and that we really need to act providing support and providing evidence to policymakers in order that they can reduce the deprivations of children with disability and help and support their families. Also, this is like, as Sabina mentioned, is a work in progress. We expect like to have more detailed results and explanations of what is creating those deprivations based on the data that we have, and continue calling for better data. And hopefully in 5 years' time, we will not only have 51 countries, but the whole set of countries in the global MPI will have disability disaggregations. Thank you very much.